Hi everyone, Dr. Kyle back with you again. I want to take a minute today to talk to you about something that I recently had to go through, and I'd be willing to bet that most people in the office either have gone through themselves, maybe a family member, a loved one, a neighbor, someone close to you has gone through, or something you may have to go through down the road. And that is what you can do before and after you have to have a necessary surgery to make sure that your body recovers in the best way possible. Now, I'll tell you this, we say this a lot of times, there's a time and place in our society where surgery and medical life-saving interventions are necessary. Maybe not for health and wellness, that's what chiropractic and supplementation and good diet and exercise, those things are vital for making sure you're healthy on a daily basis, but there's a time and place where maybe you've torn a tissue that just can't repair itself naturally, or you are in an accident, something severe has happened where you need to have the life-saving intervention of modern medicine. I recently had something like that. I tore some cartilage in my knee when I was working out about 2 months ago, and it simply was not an injury that my body was going to be able to heal on itself. So I had a surgery done on my left knee just very recently, in fact, and knowing that, I did a couple things to make sure I was prepared both before the surgery and after the surgery to make sure that my body was going to heal as much as it possibly could after we were done. So a couple things that I want to go through today, some helpful hints and tips for you that you can share, whether it be yourself or someone loved one that you're going through as well. The first is that modern surgery uses antibiotics in order to prevent the spread of disease. And thankfully they do. It's one of the things that allows modern surgeries to perform the way they do, is to cut down the risk of infection. But just like any time you get an antibiotic from your doctor, not only does it kill the good bacteria, or the bad bacteria, but it actually kills a lot of the good bacteria as well. So what I made sure to do is, after coming out of the anesthesia and after taking the antibiotics for the day that followed my surgery like I was prescribed, I made sure that I increased the number of probiotics I was taking to rebuild my healthy gut flora. Now normally I get some probiotics in the vitamin D supplement that we get here from Maximize Living, but what I did was I actually went out and I upped how much I was taking each day, and I got the 50 billion culture, that's billion with a B, 50 billion culture probiotics from Choices Market. So I'll be taking that for a while I rebuild the healthy lining of my stomach. Again, the antibiotics were necessary to prevent surgery infections, but now that I'm out of surgery, I need to make sure that it didn't hurt the good flora that I should have. The next thing I did was, after coming out of surgery, I made sure to eat a lot of high fiber foods. And the reason why is because whenever you're on an opioid or an anesthesia, it actually slows down your bowel movement and your digestion, and it can lead to what's called opioid-induced constipation. So, and remember, we don't want that, because not only is that uncomfortable and painful oftentimes, but if we just let that waste sit in the bowels, it starts to reabsorb those toxins and it becomes very unhealthy for us. So I made sure to eat a lot of healthy, fiber-rich foods. So I focused a lot on things like green beans, pinto beans, raspberries, peas, a lot of green vegetables, things that are high in food that are mostly fruits and vegetables, which we should be eating anyway. But I made sure to eat a lot of that coming out. So the very first meal when I got home that night, I had a big leafy green salad with strawberries, with raspberries. I threw some pinto beans on top, and I had a little bit of hummus on the side. Those are all things that helped my body make sure that I didn't lose any time getting that waste out of my body following the effects of anesthesia. The other thing I did was I drank a lot of water. Now, we should be drinking water every day. We know water is healthy for us, of course, but anesthesia can also affect your body's ability to get fluid in and out of the body, and you may see a slowdown in urination and things like that. So I made sure to drink even more water in the couple days that followed the surgery than I was even beforehand. And make sure I keep everything flushed out, make sure that my blood was balanced with the pH. It has a lot of great side effects, and it's so simple to do, guys. Make sure you're drinking plenty of water every day. The last thing I'll say is that I also increased the amount of turmeric I was taking every day. Now, I was taking turmeric before this to help with the inflammation on my knee from the original injury, but because turmeric is such a powerful anti-inflammatory, I made sure that coming out of surgery, because of all the extra trauma my body had gone through, that I took more than I was before. In fact, I doubled my dose. And I get my turmeric primarily from the Daily Defense supplement that we have here in the office. You may know that that's one, it was actually developed to help fight with cancer specifically, but it's loaded with so much anti-inflammatory and turmeric specifically, it's one that can be taken on a daily anti-inflammatory basis. I actually now take double the recommended dose just while my body's recovering and healing. And boy, it's healing well. I'm back in the office already. I'm helping people, which I love to do, and it's only been a few days after my surgery because I gave myself the tools that I needed in order to heal as quickly as we possibly can. So with that in mind, know this: surgery can sometimes be necessary, but if you do have to have surgery, if a loved one has to have surgery, please make sure you do what you can to prepare your body before the surgery, as well as take care of it afterwards, to make sure you're giving your body the best tools to recover as quickly as possible. Your body can heal from anything. It is amazing what the innate intelligence in your body can do. With that in mind, if you have any specific questions, please don't hesitate to speak to your doctor regarding a specific surgery or operation, whatever it might be. We can probably put together a very nice plan for you and actually coach you a little bit more on how to tackle your specific circumstance. Or if you have a family member, a friend, loved one that has questions as well, please let them know that we're here to help them as well. With that, have a maximized week. It's great to be back after surgery, helping serve you on, and I love being a part of this office. Have a great week. I look forward to helping you soon.